Hello, everybody. I'm going to try to stand behind this thing, but I'm a walker. So, when I first was called by TC, I always tell people in my presentations that she tricked me. She said to me, Joy, I got a little money, and you're the only person in the city that can do this. So she stroked my ego a little bit and then gave me some substance, right? And she said, well, it's only going to be 10 hours a week. I never worked 10 hours a week, but I'm very passionate about 38109 because that's the community that produced me. And so we were talking a lot about the congregations, and the time that I came along, CHN was about 8 or 9 years old, maybe 7. And they had perfected almost teaching congregations how to take care of their members. But there was an issue. A lot of Memphis churches, probably like a lot of your communities, are commuter churches. So the individuals drive in on Sunday and Wednesday, and then they drive back to the suburbs to live. But guess who's watching in the security over your properties? The people that are across the street, right? And so we came up with an approach because we knew the strengths of the congregations where they could do accompaniment, they could convey, they could great connectors, right? Story, sanctuary, blessing, prayer, and they had the ability to endure. That's something that a lot of healthcare systems don't really do a great job of, right? So we needed them. So we started this faith-centered navigation approach. And basically, everything that we did, the congregations were the common denominator. So as TC talked about, we got a grant from Cigna, and we were able to stipend 10 congregations within this zip code to help us take care of members that are outside of their congregation. So if a person came to one of our wellness events that you'll see in a second, and they had an immediate need. So I wrote an article a couple of months ago called Death to Health Fairs, okay? Because with a health fair, what do? You go in, you get a bag, you sign your name, you walk through all the tables, right? And you never look at that bag again until what? You decide you need a bag. And then you dump everything out of it, and then you use the bag. So we wanted to do something like a care management approach. You know, in healthcare, case management kind of stops when they leave the hospital, right? You may get a phone call, but it stops. So what we did was we paired community health workers or some of the liaisons that were trained in those churches to basically sit down one-on-one with TC when she came through to get her blood pressure checked. So basically, we use medical students. We lose whoever would volunteer, okay? But basically, when you're in a traditional health fair, if your blood pressure is not so elevated that you need to go to the emergency room, we just push you on through. But we needed to give them a hard stop. And we needed to partner with our safety net clinics so that they would have somewhere to go, whether they were insured or uninsured, right? And so part of that was, okay, we've done the appointment, but guess what? I can't afford the copay. So the churches would be able to take a referral to make sure that, number one, they had transportation barrier eliminated, because almost all churches have a church van, okay? Copay barrier eliminated. And if they had medications, those funds could be used for those, barrier eliminated. Deeper down, if you needed food, not only would we give a referral for the church to take you to go buy food, but they would teach you how to shop on a budget. 4 barriers eliminated. But what we've done is we've elevated the trust for the church in the community. So when the hospital, we didn't know how long we were going to have funds to stay in the community. So if we ever pulled out, the church was still the asset and they were still the resource. Okay? So we had focus areas, the CHN did. And I'm going to go past all of that because I want to stay on time, okay? So Wellness Without Walls was created. This is my heartbeat, you guys. And basically it was pop-up wellness clinics, what I just told you about, that happened in the communities. We took healthcare on the outside. Hospital administration didn't really understand it, but my takeaway was, hey, we're a faith-based organization, right? And faith is the substance of things hoped for and the evidence of things not seen. So we're going to make it up as we go along, right? And so we did all types of services from when the ACA was real new. We had navigators come, and we had a story that came out of one of the events that TC, we all love her, she lost her keys. She came in to do face painting. Now, we're in this highly crime infested community, okay? John Whittington with IHI came and did a site visit, and he said, Joy, this community reminds me of New Orleans after Katrina. And I looked at him, I said, it's not that bad. But to see an outsider's eyes, right? I still see the beauty. When I go there tomorrow, I'm going to drive up and I'm going to still see the beauty, okay? And so TC lost her keys. We don't know what happened to her keys, but we looked all over the community center for TC's keys. It's over at 1. It's 2 o'clock. We still looking for TC's keys. So I had befriended, because, you know, when you go into communities, you have to find out who the other assets are. Churches are a big asset, but my goal was not the church. My goal was to use the churches as a vehicle to get to the people that lived across the street, down the street, the bobos and the guys at the corner store, as my colleague talked about. So there was a person that walked up to me. I'm probably about 14. I put some little shoes on, so I'm probably about 4'11" now. And he was 6'2", and I had a little small 2-door car, and he stopped my car door when I went to open it. And I'm like, oh, I'm saved, but I ain't soft. So we're going to play today. And so he opens this door, and he's like, are you afraid of me? I said, for what? You should be scared of me. And he was like, I've heard through Pastor Kendricks that y'all were over here doing something. I need to know what you're doing. And so I'm like, who are you? He said, you see those tennis shoes on that line? Do y'all know what the tennis shoes on the line mean? What it mean? Gang, that's where one gang line begins and the other one ends. He said, on the right side of these shoes, this is my territory. And in order for you to come over here and do anything, I have to bless it. I'm like, but the church has already blessed it. You know, and so we couldn't find TC's shoes. I mean, her key. So I called Big Dog, and I said, Big Dog, look, it's the Toyota out here across the street from the community center. Please don't let anybody touch it. I said, we don't know. TC's going to get her extra spare keys, and we're going to come back. When TC got back, TC's keys were on the ground by her door. So it's our hypothesis that he found out who had those keys and ordered them to put them back, because he trusted us. Big Dog. Big Dog. And so it's things like that that make you even be over and beyond. Big Dog will pull up with vans full of African-American guys to take flu shots. Who does that? They have to make me take one, you know, and I'm kind of, you know, but, and I'm a healthcare professional, but he would never take a flu shot. I have never taken his blood pressure. His blood sugar has never been read on any of our data, but his mom was very ill, and we got his mom in hospice. So it was all about, so when it was time for us to move from this one community to the next one, you could stand there and watch the tennis shoes move. As far as we got down the street, he would take over the next territory so that we would be safe. So you would think Big Dog is an asset and he a liability. But every Saturday morning to the date, the little kids in the area, I heard somebody say kids go home without food or go home hungry after school. They're in the park at 10 o'clock on Saturday morning. He's feeding them McDonald's, but he's feeding them something. We partnered with anybody that will partner with us, for real, right? This is a summer camp. One of the pastor that was on the slide that TC showed, he said, Joy, I want to do a summer camp for 25 children. That's not 25 kids. That's 185 children. And so we went back to our associates and we said, put your money where your mouth is. We need to make sure that, okay, health touches every sector. We need to make sure that these kids are kindergarten ready. So we need to take up funds. We gave funds from our PTO or whatever we did. We raised $14,000 in a week. Each one of those children's got a week worth of uniforms, a pair of tennis shoes. They had all shots, all physicals right there at their church. McGruff, the crime dog, came out. They almost knocked him over, but I didn't put that slide on there just for liability issues. So the lady that's sitting there with the other on the your right, well, your left, y'all know what I'm trying to say. But she was the executive vice president. Her name is Donna Abney. And to know Donna and to see her sit there with kids on her lap, she does not have a maternal bone in her body. I promise you she doesn't. And Gary clapped because he knows. But she, when I came back and certain things would happen in that neighborhood, I left out because I got a phone call from that neighborhood just now. And I live in Florida now. But certain things would happen. I got a call one day about an elderly woman who didn't have air in her house, and it was 96 degrees. So I leave the 8th floor in our executive tower, and I run to the neighborhood, and I pull out my corporate card and about 10 fans. Messed it up. Hotter. So we had a board meeting at 2 where we were going to talk about this initiative and how we could stretch it. And I'm like, I got to get back. I get there, and I can't even present because I'm just like, she's in there. She's COPD. She's hot. She's going to be at the emergency room tonight, and that's another part of my job to keep folk out the emergency room. I just said, can somebody write me a check for air conditioner that'll plug into, that will stand up? Because she said, Joy, I have an air conditioner, but I don't want it in my window because somebody broke in and stole the money from under my mattress. So that was a teaching moment. If they stole it from under your mattress, that was somebody close. So somebody wrote a check. We went and got the air conditioner, but, my smarts didn't understand that it had to vet somewhere, right? So we were able to call one of the churches, Pastor Winston, and he had a maintenance man, and the guy came and cut a hole in the floor so that the vent could go out under her house, but her house was cool. Had we not spent $350 on an air conditioner, there could have been a $350,000 medical bill. The findings when we first went into the community, we saw that less than 1% were members of one of the 38109 congregations. So we were meeting the people. The numbers, not at all surprisingly, probably to any of us, 79% of them had a calculated BMI over 28. I probably was in that because I probably let somebody take mine. And then we started the familiar faces. So they saw what we were doing on the ground, and they said, well, we have to have a hospital tie back to this. And so the goal was to give me, now I'm still a one person, no staff at the time, the top 100, what's a familiar face? The people that show up at the emergency room every day. Gave me an open schedule, study these folks for 6 months, let's figure out what we can do. The way it worked was we flagged their medical record based on those charity care dollars that TC talked about. All of them had chronic health conditions. They were comorbid. They had, like she said, cocktails of them. The median age was 35. We thought we were going to see a lot of end-stage renal failure because we knew that the dialysis clinics were popping up. But we didn't see a lot of those. We saw a lot of everything else. So that goes to show that sometimes what we think is not always right, okay? So the navigator, who at the time I was, is just socioeconomic stuff. Showing up, we get a flag. I don't go in and say, TC, you've been here 17 times since January. Why you keep coming? I come in to build the trust. You got any immediate needs? 9 times out of 10, it's going to be I'm in pain. I can't do anything about that. It's a nurse on duty. So what I'll do is I'll go get the nurse and say, hey, I need you to come with me. But it was an education moment because I was able to hear the conversations at the nurse's station. And I was able to say when I got to another level, we need to train healthcare providers on how to handle all individuals and not just the ones that show up when they're supposed to, okay? So the results from this were alarming. I don't know if you can see this. So we started the program in 2014, so that would be the baseline, okay, the 92 patients. By 2015, 87. I told you that they were very chronically ill, okay? So they passed away. Within the first year, the total cost was decreased by 45%. So then, once again, I got the feel-good part, and then I got the clinical part. And so the executive team says, Joy, well, we got to make sure that it's not you. You got a good personality. You can talk to everybody. This may just be the Joy effect. So they said, hire somebody, train them, but you can't touch their patients. You can coach them, but you can't touch their patients. This is the second cohort, and she did better than I did in the first year. So this ties it all together. Now, when I told you when we first got the Cigna money, we gave micro grants to churches of $1,500 because we wanted them to take care of the community members. Well, when we got to this point, we had to magnify those micro grants. And we had 3 churches that we gave $5,000 to help us with these individuals. Most of these individuals were insured. So it'd be small things like, food. We did have to buy a CPAP machine. One time it was a utility bill for somebody who was on oxygen because our policies say that now they can disconnect you if you're on oxygen. So it was just whatever the need was, okay? So that's it. If I can bore you with the first patient that we got in that Familiar Faces, she's very near and dear to my heart. It was January 14th of 2014, and we didn't even have the flagging of the medical records in place yet. And so I was looking at the data, and I had a case manager for each one of our MCO plans. And when I called the one from Blue Cross or Blue Care, she said, Joy, and I can say her name because she signed off on everything. She said, Amber is in the emergency room now. So I put on my cape, the Superwoman cape, and I run down to the ED, and she's 19 years old, 76 pounds, about 5'7", and she's bald in the fetal position. And I'm like, wait, somebody got to tell me something. So I talked to the people at the nurse's station, and what you think I got? She come every 3 days. She just coming to get pain medication, and then she going to go on, but she'll be back in 3 days. So I said, well, let me look in her chart. She had just had a gastric pacer put in. But she hadn't had a PCP appointment since the year prior. So how did you get that referral to go and get a gastric pacer in? So with this community, and she was a 38109, her home is right next to Pastor Kendrick's church, that Health Watch TC was talking about, and she was a member, but he had no idea this was going on. Okay, he would see the grandmother, but not the child. And so we dug down a little deeper, and it was some financial gain involved. She was a part of a study, and she got the pacer put in. But what they don't tell you is they put it in, but then it has to sit before they can cut it on. So she had put it in. They had it put in the week before I met her. And so finally she goes up to the floor, and I can distract the grandmother, and I'm like, so let's talk. She said, well, Miss Joy, she said, I just want to be the first person in my family to graduate high school. She said, but the last 2 years, they've just pushed me through. And so she and I made a pact. I said, Amber, I can get you graduated. I can get you educated. I can get you a homebound teacher. But the homebound teacher cannot come to the hospital to educate you. So if her cycle was every 4 days, she was inpatient for 3 days. So she had 57 inpatient stays in 1 year. $2.2 million in charges over 3 years, just one patient. So we worked hard, and we hit it running. I had to fight nutrition at the hospital. It was a lot going on. And finally, 5 months later, Amber was making her own doctor's appointments. She was keeping her specialty appointments. She finished high school. She went to the prom. She went to school. Amber just had a baby last year. But for us being there, but for us partnering with Pastor Kendricks, what would have happened to this now 23-year-old young woman who has a message of hope. If I could, I would take her everywhere I go to tell the story. So thank you guys for listening, and continue to do the great work in your communities.